Well, it's World Breastfeeding Week. This year's theme is Protect Breastfeeding, a shared responsibility. Now, in many countries, the COVID-19 pandemic has caused significant disruptions, we understand, in breastfeeding support services. This has also increased the risk of food insecurity and malnutrition. Let's unpack this further with UNICEF's nutrition specialist, Charity Zvandaziva. Ms. Zvandaziva, good afternoon. Welcome to the Midday View on eNCA. Can we just start there? How bad has the COVID-19 pandemic impacted on your programs in promoting the importance of breastfeeding?
Thank you. Yes, so our program, breastfeeding, is mostly delivered through the health systems. And the health systems were very, very much affected by the COVID pandemic in several fronts. Firstly, the service providers, the health workers, were affected. They were overwhelmed because of the pandemic. This means the skilled counseling that the mothers are supposed to get on breastfeeding was affected. Secondly, because of the travel restrictions imposed by COVID-19, meant that our mothers were not able to access health service to get the counseling from there. So on that front, it meant that mothers were not able to access the counseling. We recommend that they should get 6 contact points with the health workers on counseling on breastfeeding. This could not happen because of the pandemic. Furthermore, there are also other challenges which mothers are facing, like fears of transmitting COVID through breastfeeding, although we know from research that there is insignificant transmission of COVID-19 from the breast milk.
So what is the message? What is the message you give to those mothers who are worried that if they have got the coronavirus, they might transmit it through breastfeeding to their babies?
The message that we are giving to mothers, especially during this World Breastfeeding Week, where we are saying protect breastfeeding, it is a shared responsibility. Mothers that are asymptomatic, they can breastfeed their children without fear, maintaining the recommendations on making sure that they cover their mouth. They also wash their hands. They disinfect the surfaces to make sure they do not transmit the virus. For those that are severely sick, they can express their breast milk, and other family members can support with feeding. We are also encouraging our breastfeeding mothers to also get vaccinated against COVID-19.
Okay, I mean, this is a week that you are highlighting the need for it. And of course, I'm sure you celebrate the health benefits of breastfeeding. And when it comes to that, what is the message this year, particularly about the significance and benefits of breastfeeding?
So in this particular theme for 2021, Protect Breastfeeding, a Shared Responsibility, we are highlighting the links between breastfeeding and survival of the mother, of the infant, and of the nation as a whole. So we are saying, yes, it is important to support individuals to breastfeed, but it should be a shared responsibility where investments should be done at all levels. That is in the health systems, where our mothers get the counseling services. Also in the workplaces, the mothers should feel free to breastfeed their children. They should have safe spaces to do so. And also in the communities, mothers should be supported to breastfeed. So it is indeed a shared responsibility across all the players, government, donors, private sectors, in the community at large.
Charity Zvandaziva, asante sana. She's UNICEF's nutrition specialist talking to us on this World Breastfeeding Week about the importance of breastfeeding. The World Health Organization and UNICEF, the organization that she represents, running this campaign this week under the theme Protect Breastfeeding, a Shared Responsibility, and emphasizing to all mothers who may be concerned that if they've got the coronavirus, they don't have to breastfeed. She says, no, you can. It is safe, but do take all the necessary precautions yourself.